everybody. My name is Justin. I'm in South Florida. I'm a volunteer leader for the South Florida area. And once upon a time, no shit, there I was in Louisiana, Ian hurricane, and I found myself processing a mango tree that had fallen up against a house. It was right up against the house, so I was the senior sawyer. I kind of got stuck with it. And that evening, I found my body had exploded and I had no idea why. So the sawdust had gotten all over my body. And you all know those terms don't become the purpose or the reason of a safety briefing. Well, there I am. All right. So it turns out I learned the hard way that mango sap has the same nasty stuff as poison ivy. And imagine trying to find an emergency room that's open in Louisiana a week after a major hurricane. So I ended up going from hospital to hospital and had to go twice and ended up getting sent home, and it was a mess. So because of that, that was quite a few years ago, I decided it'd probably be a good idea for everybody to maybe learn about the stuff that we shouldn't get into, because it turns out poisonous plant exposure in all of our operations statistically is our biggest injury that we have incident reports about. So, yay, I'm not the only one. Boo, other people are getting hurt. So, I would like to introduce to everybody here Dr. Wendy Blair Stephan, right? She is University of Miami and part of the Miami Poisonous Control Center. Is that what we go with there? Yep, I think so. And Dr. Stephan, we have a bunch of gray shirts from all across the country and Canada, and we have up to over 100 folks registered. So this is, whether they watch the recording or come in live, this is going big time. So I would love to pass it over to you, and thank you so much for being here.
Great. Well, thank you so much for having me. This is a great opportunity for us to talk about some of the hazards associated with contact with plants, the sort of up close and personal contact that you described, which is not normal for most people, right? I know many people think about the Poison Control Center in the context of children and child exposures. Certainly, we do take calls about pediatric exposures from families, but actually these days we're taking about as many calls about adults. So, feel free to call us. It doesn't have to be about a child. And know also that wherever you are in the United States, there is a poison control center that serves your community. So today we're going to be focusing on Florida plants because we're a pretty unusual area. And of course, we're subject of storms on a regular basis. But for things that are occurring in your own backyard as part of your normal activities, your local poison control center will be the service answering your calls. And they will have expertise about local plants. So I want you to think about the Poison Center, certainly for your disaster response work and your volunteer role, but also for your own role in your daily life. Okay, let me go ahead and share. Also, Canada has poison centers too, so not to leave Canada out. We work with our colleagues in Canada as well. All right, so Justin, you seeing the slides?
Yep, good to go.
Wonderful. Okay, perfect. Well, this is a custom-made program for your organization. And so very, very pleased to be sharing the information. And so please, if you have questions, Justin, I only have one screen where I'm set up today. So if you see questions in the chat, will you let me know? And I'm more than happy to stop and address them.
Of course.
Great. All right. So some information about me. So I'm the educator and epidemiologist at the Poison Control Center in Miami. We're one of 3 Florida centers, and we cover the whole state. My area is South Florida, and my colleagues, Jeffrey Bernstein and Dr. Richard Weissman, are both reviewed the content of this presentation, and they are our medical director and executive director. They also serve as our consults whenever a call comes in to the Poison Center that is critical or complex in nature. So we're going to talk a little bit more about the hotline and what we do. Okay, so there's the phone number for the poison helpline. If you remember nothing else besides this phone number and this resource, I will be able to breathe a little easier. Justin, when you described your exposure, you know, that's the type of thing people do is they're miserable and they're running around and they don't know, is this something that's life-threatening? Is this going to get worse? How long is this going to last? That's the type of question actually that we can answer over the phone immediately for free. So, you know, that type of initial assessment, listen, I was exposed, I'm having these symptoms, what do I need to do? If it's possible for them to manage it with you at home, they will do that. They'll walk you through, particularly in a crisis, right? We're all about efficiency. And of course, during disaster, we really don't want people flowing to the emergency room who really don't need to be there, right? Sounds like your symptoms were pretty miserable. So you probably did need to be there.
Yeah, I got hit hard.
Yeah, so we'll come back to Mango. Sometimes those calls do come to us not from the patient directly, like in the home setting, but the call actually comes to us from the hospital. So an emergency room physician, of urgent care, a pediatrician, they're treating a poisoned patient, and we're providing them with management guidelines. So when you call us, you're actually getting the same service, a level of consult that a physician would. So it's pretty great. For our seriously poisoned patients, we actually follow up until discharge. So that's really quite amazing that it's also, again, paid for typically by your state Department of Health, with a little bit of federal funding there to make it a robust national system. Okay. So we'll come back to that. Just before we jump into this, and I'm sure you have all sorts of, you know, rules and standards for your organization in terms of training you receive, but just to really come back, I will not be able to discuss all of the plants that can result in skin contact, right? That's sort of the challenge with plants is there's just a lot of them, right? So we're going to hit some highlights, but you don't have to worry about the plants and the contact if you are wearing the right gear, right? So certainly we want to know some of the important ones, but you know, wearing the right gear would, and by that we mean coverage, covered arms, sleeves, long pants, closed-toed shoes, eye protection, and gloves. These typically are the things that will protect you from, you know, direct contact. We also want just to remind you the importance of getting first aid quickly. Like if you start to notice pain or burning or blistering, stop immediately and address it, because sometimes short-circuiting that, whether it's immune response or you know, a neurotoxic response, that makes a huge difference, right? As opposed to letting it continue to build and worsen. Okay. And then, of course, getting help in time, and our number may be part of that process for you. All right, so what are the types of things that we can see after a storm? Certainly plant exposures are going to be specific to your group, but we also see medicine mistakes and overdose after storms. This is often because, first of all, the power has gone out, right? So people are under a lot of stress. They can just make mistakes because they can't read the labels, or, you know, they're in multiple families jammed into homes, you know, sheltering. We also see people who rely on systems to protect their recovery, whether they have alcohol or substance abuse issues. You know, the meetings and the medications that support that recovery may become harder to get after a storm. So we do see increased drug and alcohol use and abuse in that post-storm period. We also see bites and envenomations. So this is different, you know, insects and snake bite. We're going to come back to that at the end of the program briefly. We also see carbon monoxide poisoning. So this is very important if you're using any gasoline-powered tools. So whether that's a generator or a gasoline-powered blower, these pieces of equipment throw off a huge amount of carbon monoxide gas. You know, even compared to a vehicle, for the size of the equipment, they throw out a very high proportion of carbon monoxide. So if those are being used in closed areas or areas without good ventilation even, we can see carbon monoxide poisoning very rapidly. We do see radiation poisoning, right? That's sun poisoning, where people who have been in the sun for too long start to have sort of full body systemic effects, not just localized pain from a sunburn, but so you start to see some physical, some actually whole body chills and fever and some other reaction. And that is actually a reaction to radiation. We also see food poisoning after storms, mostly because of spoilage and, our water that has been contaminated by flood water or other similar lack of refrigeration. Okay, so just putting the plant poisonings a little in context, because there's quite a bit that can happen after storms that we are monitoring and that CDC is also monitoring. So, and just before we jump into the skin contacts, when we think about plants responsible for poisonings, thank you. In the world today and historically, there's really no comparison to the opioid epidemic and the opium poppy, right? So opium was first discovered as being biologically active, from this plant. It turns out that our bodies actually create an endogenous chemical, very similar, that we rely on for pain relief, etc., in very small quantities. But when we take it in from the outside, it's pretty dramatic effects. Great for controlling pain for surgery, but very concerning in terms of addiction and overdose. So I do recommend for your team that you do have naloxone as part of your kit. Even if people are taking prescribed forms of an opioid for pain, it is pretty easy to combine it in ways that are dangerous and lead to an overdose. So naloxone is now available over the counter, which makes it a lot easier to have. Okay, so we have two different categories of plant exposures that are of concern. So, certainly we have a whole bunch of plants that we wouldn't want people to eat. And these are the plants that are most likely to result in actually a fatality, are plants that are toxic that someone has consumed, right? And I know Justin was saying, please don't eat the plants. This is just generally not a good thing. I spent quite some time on this with the gardeners because it is possible to make mistakes, and eat the wrong thing. But so, for instance, one of the plants that is very, very toxic in many forms, including ingestion, would be the oleander. You see that here with its pink flowers, native to South Florida. Well, I don't know if it's native, but it's widespread in South Florida. But then we have a very large group of plants that are not safe to touch. And I think the most famous or well known is the stinging nettle. And so sometimes these plants are actually puncturing. These are so mechanical means, but the bulk of them are actually using a form of chemical warfare to protect themselves. And that's the ones that really can be quite surprising in terms of their intensity and the dramatic symptoms that they can cause. All right, so we're going to start with that first category, where we see someone consuming a plant that is toxic. And these are the three we see for adults, right? I'm not going to talk about child poisoning because none of the groups, none of our folks here today, are here for child safety issues. So the ones we see for adults are going to be the three you see here. And so Angel's trumpet is the first. This is a plant that some people will intentionally consume for the purpose of hallucination, or, they're expecting to have, interesting symptoms from using it. The people who know what they're doing will use a tea. But unfortunately, often people don't know what they're doing and get very, very sick. We're also seeing much more poisoning today associated with the consumption of wild or hallucinogenic mushrooms. So this is across the country, but also here in Florida. And unfortunately, the psilocybin-containing species certainly have their own problems, but we also see people consuming mushrooms expecting a hallucinogenic effect and instead having a hepatotoxic, a liver toxic, or kidney toxic effect. And finally, the herbs and roots. We have a lot of people who are interested in wild foraging, and they see, plants in the environment that they believe are familiar, right? They look like parsley. They look like, carrot and some of these other things that people are very interested in wild harvest, but maybe don't necessarily have the experience to do it safely. So we see people consuming things like water hemlock, for instance, which is highly toxic. Okay. So, if in doubt, give us a call. We're there to assist. But these are the ones that we see, adults thinking they're doing one thing, or doing something with an intention that leads to, unfortunately, to toxicity. Okay, so now moving into the acute allergic contact dermatitis. So these, for what you're doing, because of your close contact with plants, this is where the bulk of the plants will be in this category. All right, the first and best known, and you already mentioned the class, Justin, is the poison ivy. So there are different varieties around the country. So the poison ivy that is in your community may actually look a little different from this, but the poison ivy species in Florida that we know best looks like this. And you can see, if you look closely, you do see the leaves of three, which is what people often remember, there are three leaflets. But with the Florida variation, I find that that's a little bit hard to see. And so what I notice first about this plant is that it is kind of floppy and shiny, right? That it looks a little limp, and the leaves are shiny, and it's more of a vine than a bush. And so you'll see this kind of in low areas and then climbing up trees. Usually for us, not in highly populated areas. This tends to be more wilderness areas that are affected. So if you're clearing roadways in parks and sort of more wild areas, that's where we would expect to see poison ivy. And that shine that you see on the leaf is actually an oil called urushiol. That is the oil that will not only get on your skin if you have contact, but it also gets on clothing. And so we're going to come back to why that is so potentially dangerous. On the right, you see the flower that it can actually, during part of its life cycle, it has what looks like a little, like a bud, first a green bud, and then a small, small white flower. So on the left, you see sort of before it gets to that stage, and later you'll see the little white flower. Okay, so the urushiol, when people come in contact with it, even briefly, it actually kicks off, not in everybody, but in a subset of people. We estimate it's about a third of people, an actual immune reaction. So it's not that the oil directly is toxic. And this is why it can be a little confusing, right? You'll see a bunch of people exposed to the same bush, but only a few will come down after some time with these really extreme blisters. And that's because their bodies had that sensitivity. My mother was hospitalized in college for actually, exposure to poison ivy. And so almost certainly I have that same genetic vulnerability. It's very interesting because it's not everybody. And this one is what we call an immune modulated sensitivity. All right, here's the eastern poison oak. You can see that it has an oak tree-like leaf, also three leaflets, and you see the berry here as well. So Toxicodendron toxicarium. This one is a little interesting, and so you see the blistering is slightly different. This blistering, for whatever reason, tends to have more stripy effect as opposed to the large singular blisters, and that may be because the oil is also distributed on the stems more so than on the leaf. So you'll see both sort of. And at first glance, to me, this looks a little bit like a jellyfish sting. So if you're seeing a jellyfish sting, but you haven't been in the water, then you should think poison oak. Okay. In Florida, we also have poison sumac. This is much less common, and it looks very different from the other two, which I think makes it a little difficult to spot because you're not seeing that traditional leaves of three. What you're seeing is pairs of leaves on a red stem. And then during certain time of the year, you do see again, the small green berry-like protrusions at a certain time during the year. So Toxicodendron vernix. And this is a low shrub, so not a vine. And I think this is the one that sometimes people can be basically tricked and not notice it until too late. Another one that is pretty unique to South Florida is the poisonwood. And you see here the shiny leaf again. Not all shiny leaves mean oil, but this particular one does. And you can see on the right, and my screen is in the way, that what you're looking for in terms of identifying this one is going to be these sort of weepy black lesions on the stems, and this is the oil, the sap that is coming from the tree that causes the contact. So of course, if you're dealing with a tree that's been damaged and torn up, that sap is going to be much more available than a tree that is whole. But it still is potentially a problem. You can see it right there. All right. Justin, do we have any questions? Yeah, I just don't want to power through any.
We did have somebody asking if they can ask questions, so
Oh.
I guess this would be a good opportunity.
Sure, go ahead.
Let's see, that's Stephen.
All right. Nope.
I guess we're good.
Okay, I'll go ahead then. All right. All right, so this brings us back to, what Justin mentioned was mango. So very interesting. I was actually not aware that the wood itself would have the same characteristics, but we know that people who have that sensitivity that I mentioned to, that genetic vulnerability to poison ivy have a similar reaction to the skin of the mango. So if you've ever had a bad experience with poison ivy, or if you've noticed that if you peel mangoes, you get reddened hands or blistering or irritation, that these are in the same family. So interesting that the wood has the same effect. You must be very sensitized. And remember, because this is immune, it's like other things in your immune system, sort of like even with bee sting, right? Once your immune system is primed, you're going to have a more extreme reaction. So if you've had any type of reaction to the peel, not the fruit of the mango, or if you've had blistering from poison ivy in the past, you should expect a more severe reaction the second and third times if you are exposed again, because essentially your body is now primed for that larger reaction. This is why it's so important that people carry that EpiPen if they've had, exposure to, if the sensitivity to a bee sting. Okay, so many times people realize they've been exposed sort of after they've been thrashing around in it for a little while, right? But the good news is, because this is an immune reaction, it does take a little time. So if you realize that you've been exposed to one of these plants, you're going to clean the area with soap and water. You have about 45 minutes to get in there and to get it off you. Again, soap and water. Now, there's also the question of clothing. Remember that oil may have transferred onto the gear you're wearing. So I don't know if you generally get instructions about doffing clothing, but the idea of from the top that you're rolling it down and under, essentially, and then again, once you've removed your clothing directly to the washer, just by itself, you do not want to mix those clothing, that contaminated clothing with baby clothes or other family members' clothing, and then finally wash your hands with soap again. Okay, so if you have areas that have begun to blister and have, sustained itching, we do recommend you seek care. So you can start with a call to the poison centers. But because once cases affect large areas, you may need to be taking some sort of oral steroid to dampen down that immune effect. And that treatment can last for quite some time. Okay. All right.
Sure.
So
We
when
do
I,
have some questions if you want
okay,
to take a moment here before we get too
sure.
far. So I'll read them to you. Let's see. We've got
Thank you.
I think we covered this, but if someone is allergic to poison ivy, are they most likely also allergic to poison oak or sumac?
Yeah, it's a similar process. People will say they're more or less, they get a greater or less reaction depending. But yes, they're similar enough that you should assume if you've had a reaction to one that you'll be sensitive to the other.
Hey, all right. Here's Stevens. He chimed in with a doozy here. So, in a disaster environments where responders are fatigued, dehydrated, and working in unfamiliar ecosystems, yep, that sounds like us. Which toxic plant exposures tend to be most under-recognized or misidentified in the field? And what patterns do poison centers consistently see after hurricanes or storms?
Yeah, so in terms of plant poisonings in general, it really you have two different questions there. So one is in terms of plant contact, what are we seeing most? It's going to be the irritating, the rash type things, the sensitivities, the individual sensitivities, eye exposure. Those three would be, I think, the biggest. Those are unlikely to be fatal, but they certainly can be miserable, very painful, and take you out of service, as you mentioned.
Yeah.
In terms of frequency for plant poisonings that the poison control sees around the country, a lot of it is child exposures, I have to say, right? Even after storms, because remember, kids now are home, and there's debris everywhere. So even if you're not volunteering to clean up, there's a lot of cleanup happening around homes. And unfortunately, people do sometimes involve kids and teens in that cleanup. So we get a lot of those type of calls. But we're going to keep going through a few others. So I hope we'll develop that answer a little bit more. But
Love
yeah, in
that.
terms of fatalities, there's no question it's the carbon monoxide,
Yeah,
not
absolutely.
plants. Yeah.
All right.
All
Let's
right.
see. Somebody's asking if washing with Downy helps counteract the oils.
Any soap, right? It doesn't have to be a special soap. Because it's an oil, you're just using something that's a pretty strong surfactant. So Downy, typically that's more of a fabric softener that is going to coat sort of a waxy coating on clothes. What you really need is the soap to break down that oil and then rinse it away. So I have not heard anything about using Downy separately, but that would be a good question for the Poison Center, for the doctors. So the people on the hotline are all physicians with tremendous amounts of experience. And so each doctor may have their own sort of take on what they've found to be beneficial. So, we have some standardized protocols, but we also have some variability in terms of our individual poison specialists.
Okay. So we got a bunch coming in, but some of them I want to kind of stay on topic and we can have a Q&A after you finish your presentation. So let me just scooch through here. And do
And if
some
you know
people
I'm
have no
covering it,
reaction?
because you know what's coming, so then
Yeah,
you
yeah,
can keep
exactly.
going.
Yeah. So let's see. Do some people have no reaction to ivy? Yeah,
Yes.
I think so.
Yep.
I am not that person. Let's see.
Not at
And
all.
somebody said breathing sawdust. Yep, that's a concern that I have as well.
Yeah, it's
So
the
if we
oil.
ingest, yep, okay. So yeah,
Yep.
that was part of the problem of why I had to get treatment was it affected my breathing.
Yes. Well, and that's this slide here. So when I mentioned to my director, Dr. Weissman, who's actually formerly a member of the disaster medical activation team, so the DMAT. So they actually go and set up field hospitals and operate those field hospitals. I think the last one he participated in was Hurricane Michael. I mentioned I was doing this program for you, and he said, tell them not to burn the poison ivy, which I had never thought of. And he said that's some of the most extreme and potentially fatal exposures he's ever seen associated with poison ivy, or any other plants with these oils is when people burn them. And I get it. It's like, oh, kill it with fire. This is a time that it's really a bad idea, because what's happening is it's now aerolizing that resin, that oil, and people can inhale it, and it blistering in the lungs is very, very extreme, right? So that's very difficult. And then his next suggestion was, if you know you're going to be dealing with poison ivy, if you can see it, you've identified it, but you still have to address it, he does recommend wearing a Tyvek suit that can be disposable. He said, unfortunately, that is very, very hot. Right. Depending on when you're activated, you will be in that suit for a very limited time. So we see that with our decon team here. When they're suited up, they're not good for all that long, just because they get very hot. And then eye protection, really important, because if the blistering is on the ocular surface, obviously that's complex and quite serious. Okay. All right, Justin, shall we continue, or?
Sure, absolutely. Yeah, we
Okay.
we are provided Tyvek suits, and we usually, depending on conditions, we have very strict work rest cycles, because you're right,
Excellent.
they get
Yeah,
very
because
hot.
really hot, and we see people's blood pressure going up, and that's another danger too. All right. So we do see some complications, right? And again, as I mentioned, stopping work if you're identifying that you're starting to have a reaction early and starting to treat it, reduce exposure, do the washing, etc., as soon as possible will prevent some of these complications. So the first one that we see is, because the itchy areas, people do describe it initially as an itch and then later as burning, people can scratch, right? And if you're itching and you don't realize what's happening, you can unconsciously really do some damage that can lead to scarring. These scarring, or these excoriated areas, can be infected, right? If again you're open to the air, you're not wearing the protective gear, or there's gaps in your gear, is you can see pretty serious infections. And then occasionally we see people just using treatments that are just worsening the situation. So, we see people with skin problems, or, rash. They don't necessarily know what it's from. And they say, like, well, I just want to put gasoline on it. This is no joke, so, or they've seen something online, like, and they're, doing something they saw on TikTok, and sometimes that can make things much, much worse. So we just suggest, before you take any steps, to address it, try to talk to someone with some expertise to protect yourself. All right. So now, shifting over, on that same idea of eye protection, these are two categories of plants that really pose particular danger to the eyes. So whenever you see the species name Euphorbia, right? So these are cacti. You see the one on the left, there's the pencil form that you see the photo of, where it's these long branching sort of sticks that are succulent in nature. But when these break, you see this milky, it's almost like what's the word? Like a latex type appearance, but this is incredibly, incredibly dangerous to the eyes, irritating to the skin, but destructive to the eye. Similar were the crown of thorns. Generally, people are more respectful of the crown of thorns because of the thorns. So that we tend to see fewer serious exposures. But when people do get these in their eyes, it can be permanently affect their vision. So this is not something that is quickly reversed. These are very, very serious toxicity, actually chemical damage that can start immediately. This is not an immune reaction. All right. Another one that's special to Florida, when it's actually been in the media recently, I'm not sure why it had its moment here a few weeks ago. There was the world's deadliest tree is in Florida. They love the Florida's dangerous stories, which, there's some truth to that. But the poison apple, or the manchineel, is one to keep an eye out, particularly down in the Keys and areas toward the water. It does pretty well Also in the Everglades, areas that other trees, may not flourish. You can see an image of one here directly onto the beach, which is pretty unusual. A lot of trees don't like the salt water, but it doesn't mind it. You can see here why people might be attracted to the tree is these small green apples. And these apples are incredibly toxic and, cause blistering internally, but also toxic sap drips from the leaves. So you never want to have too much contact with this particular tree. We've even had cases of people falling asleep under the tree and waking up with toxic lesions from the dew coming off the tree. Okay. I wanted to mention this one. Again, if you're outside with exposed skin, this one is pretty interesting. So this is a phytophotodermatitis, which is very interesting. Phyto meaning plants, photo meaning light, dermatitis meaning skin irritation. And you can see the really distinctive handprint marks on her legs. We've seen this on children. And as parents are handing a child around at the beach, when someone had squeezed a lime, and then that lime juice reacted with the sunlight and actually created a chemical called psoralen, which causes actual chemical burns. So these chemical burns will not fade back to normal skin. These actually fade back to a brown scar. So, if you are outside in the sun and someone is, making margaritas or squeezing that lime into their beer and, their Corona, be sure to wash hands right away if you're going to be in the sun, because this can be very painful and in some cases long-lasting burns. Okay. Another potential risk that you may encounter, depending on where you are, is the exposure to what we call harmful algal blooms or HABs. If you see the term HAB, that can typically mean a marine environment that's going to be a red tide, right? That would be one form of harmful algal bloom. But if you're in freshwater areas, then the concern is a cyanobacteria, otherwise known as a blue-green algae. There are a huge variety of species that are associated with different types of toxicity. But if you see a bloom like this one, where the water has turned like bright green, dark brown, you see visible or thick algal mats, particularly if there's noticeable smell, you really, really want to avoid contact with those waters. The toxins released by cyanobacteria and red tide are incredibly potent. Some are carcinogenic, and we had a boat full of Navy SEALs who boated across a bloom in the Gulf at one point, and they said that it was strong enough that they had to don their equipment that they use for like nerve gas agents, that it was so irritating to the eyes and to the throat and to the upper respiratory tract that they actually donned their protective equipment. So very, very important to avoid exposure. If there are animals with you, for instance, if anyone brings dogs or, if there's livestock in the area, you want to notify someone to keep them also out of the water. We do occasionally see die-offs of livestock and pets who've gotten into these waters. There is a map. Florida Department of Environmental Resource Management has a harmful algal bloom map that you can go and look at recent testing results. So if you're going into an area where there are waterways, I think that would be a good precautionary step to take, because if there are blooms in that area, you're going to need to think about your respiratory health, if there is a highly concentrated bloom, because these toxins will aerosolize and actually blow on shore and affect people in the area of the bloom. A few years ago on the Loxahatchee River, I felt so sorry because there was a blue-green algae bloom in the river, and there was simultaneously a red tide. And people there were just just miserable. And, we couldn't tell them how long it would last. We couldn't really tell them why it had formed, what exactly it was just the conditions were right. And they were awfully sick. Okay. I wanted also, in the context of cleanup, to talk about mold and mycotoxins. So these are toxins associated with fungi and molds. And so you may be coming into areas where not only are you outdoors, but you may be in structures or near structures that have gotten wet and now developed, mold and mildew. And just to be aware, if you detect a musty, mildewy scent, you should be wearing protective gear for your respiratory system, particularly for people who have an immune system that has any type of impairment. So particularly, say, people with a transplant, an organ transplant, for instance, people who are taking HIV medications to suppress their immune system, they are less likely to be able to fight off a fungal respiratory infection. Most of us, we can be exposed to it, but our immune system takes care of it pretty quickly. But when you get into these conditions where you can really smell that mildew, that moldy smell, there's moldy drywall in flooded areas, etc. That's a particularly dangerous environment. So the Petri dish that's shown here, this was actually in a home post-Hurricane Harvey, and they identified quite a few different species of fungi that were very, very happy in that environment between the drywall and the glue, and the different food sources that it had found in that wet environment, wet humid environment. Okay. In terms of symptoms, we know that people usually pretty quickly start having upper respiratory symptoms. So that'd be running nose and sneezing and eye irritation. And some people will cough. But again, the real concern is a potentially fatal lung infection for someone who's vulnerable. All right. Some other sort of issues when we're thinking about plants. Of course, there are so many different plants that we have to worry about. We do work with teams of botanists to help us get an identification for those plants that are less obviously identifiable, right? So our poison specialists, we have some of our people on our staff with 20 and 30 years of experience. So they've seen a lot of Florida plants, but there will be ones that we don't know. And so we will work with our botanists to figure out what the exposure is. And just be aware that images just grabbed online are notoriously incorrect in terms of species identification. So we would really prefer to have an actual shot, a photo of the plant that you're concerned about. And then we will share that specific plant with our botanists, because if you think you know what you've been exposed to, you actually, it's called anchor bias. You start to feed everything into that, and you may have the species completely wrong. It is actually quite a challenging call to make. All right. I wanted to also mention that, we're all very individual, the same way that some people have no sensitivity to poison ivy. There are other people who have really strong sensitivities to other plants that most people wouldn't. The same way, some of us can't eat strawberries, for instance. So there's genetic factors and allergic factors. So, just because a plant isn't well known to be one that causes dermatitis or is toxic, if you're having a reaction, you need to stop and address it as soon as possible. And then I wanted to mention supplements. It's just where we are right now. We're seeing people who are exposing themselves to some very unusual and high doses of plant-based drugs and supplements. So things like 7-OH kratom, kava, and cannabis at really, really high concentrations. In addition to psilocybin and some of the other natural toxins I mentioned, what's on the market now is very, very strong. And so, in a stressful environment, sometimes people do, use these substances. If you have any questions about those, you can also talk to the Poison Center. Okay. All right, so I did mention at the beginning that snake bite is one of the other things that we deal with aside from plants, and I just wanted to mention we are a resource for any type of bite or sting. These are 4 species. These are the only 4 species actually of native venomous snakes for South Florida. So you see in the upper right, that is the cottonmouth. You see him showing off his white cottony inside of his mouth, otherwise known as the water moccasin. So this is the one we would expect to see sort of in and out of the canals, for instance, living in those environments, quite comfortable in the water. On the left top, you see the eastern diamondback rattlesnake, which also goes in and out of the water, although it doesn't really live there necessarily. Those tend to be, they can get very, very large, particularly in northern Florida, up to 9 feet. Lower right, we see the pygmy rattlesnake. This is a venomous snake that is full size, 18 inches. So this is the dusky variant. So you still see he has a big head, right? So all the first 3 I've talked about all have a big head and kind of a fat body. So if you're bitten by a snake that is a big fat snake, you've probably been bitten by a viper. And those are venomous species. The only venomous species that is not a big fat snake is the one in the lower left, and that is the coral snake. Has a slender body like a garter or a racer or a ringneck, but his brilliant coloration is what tells you that that is actually the Elapidae. He is in the Elapidae family, which is the same as the cobra. So very different toxin there. So all of the vipers, the fat snakes, their poisons are hemorrhagic. Those are the ones that will cause dramatic swelling and bleeding at the area, at the bitten area. The coral snake doesn't do that. The coral snake's toxin is a neurotoxin, and its toxin will affect someone a bit like botulism with descending paralysis and slower acting, and can fool people, right? They're like, oh, this isn't a big deal. Like, the bite, it's not impressive. There aren't big holes. It's a small snake. But meanwhile, it's affecting their breathing potentially. Back to those debris piles, in addition to the plants, you have to think about some of the other things that might have also been displaced by storms. And so these are some of the different critters. So we have, of course, fire ants that can be picked up, in the floods and relocated. We've seen images, people send us images of, these floating fire ant nests. Really dangerous, of course, for people who have that particular sensitivity. They can get, limb swelling and systemic effects. But, certainly a wasp, a honeybee. We do have the Africanized variants of the honeybees here. So if you notice a lot of bees swarming, more than 2 bees, coming to the defense of a nest, or bees that are bouncing off you, like those are tagging you, and that is typical behavior of the Africanized honeybee. You're in immediate danger, and need to leave the area to get somebody to come and take a look. And then, of course, we've got some caterpillars there. The Io in the middle and the saddleback are 2 that have neurotoxins in their spines. And so people will describe radiating pain from, say, the extremity, where they have the contact up the arm and even into the chest. So we do get people sometimes who think they're having a heart attack until they get undressed and we see the marks from the caterpillar. So it's a pretty impressive sting for such a small creature. And then, of course, we've got the bark scorpion there. So all of these, are exposures that we can assist with if you realize you've been bitten or stung. And again, the sooner we hear about it, the more we can help. All right. So again, there's one of our doctors. This is Dr. Lopez. He is about to retire, but he's been with us over 30 years. And so, the level of expertise you get when you call that 1-800-222-1222 number, you really can't beat it for an immediate free service. It's pretty amazing. So again, seek care early. Get a consult. You don't need to rush off necessarily. Get some accurate information about your specific situation. Please do not rely on ChatGPT or AI summaries of a lot of different resources that are kind of then mushed into, some sort of overview. It may not be relevant to your immediate situation. So that's what we're there for. All right. Any other questions? Here's some references. I can provide those slides to you, Justin, if that's helpful.
Yeah, some folks have asked for that already. Absolutely. Yeah, let me scroll through and we'll get caught up. So someone asked, can a person suddenly develop a sensitivity if
Yes.
they've never had a reaction in the past?
Yes, they can. So we are complex biological creatures. And yeah, you can absolutely develop over your lifetime. These sensitivities can appear and disappear. And so again, you have to pay pretty close attention, first of all, to protective gear, so you don't have to think about it. But if you are developing a reaction at all, you need to stop. So I would say the most interesting sort of sensitivity or reaction we're seeing at a population level right now is actually cannabis hyperemesis syndrome. So just putting it out there, we see people now every day in the ED who were heavy regular users of cannabis, marijuana, who developed a sensitivity to it and now are vomiting. So really, really interesting case because people will argue with us like it can't possibly be marijuana because I've been using it a long time and it's never bothered me. But for some reason, people who use a lot, some of them get this reaction. So yes, absolutely.
Kind of along the same lines. Well, not really, but how long does it take for symptoms to appear?
So, usually right outside, if we're talking about the poison ivy, is that sort of what or is
I guess just in general, maybe it
there's a huge
probably depends
variability.
on what it is. Yeah.
Yeah, huge variability. If for any of the ones that have the immune component, that's going to be a delayed presentation, which is very frustrating because by then, you've been thrashing around in it. And if you didn't notice it, now hours have passed, you haven't washed anything, you've exposed everything, you've exposed your vehicle, all of your gear, etc. It can be really difficult to get that cleaned up. But my most recent plant poisoning was I was out gardening and I was wearing all my gear and I had a gap between my sleeve and my glove and I got poked by the century plant and within 1 minute I had the most deep and radiating pain down into my joint, into my wrist. It was really scary. I thought I might have a spine that had like somehow gone down into the joint. Turns out it has raphids, it's oxalate crystals. That had caused that pain. So it was a nerve, it was inflaming my nerves down into the joint. It was really frightening, actually. I did call the poison center. I was like, it's me, it's Wendy. What's happening? And sure enough, they're called raphids. They're these tiny little oxalate crystals that the plant was using to defend itself. And it got me right between my glove and my sleeve. So
A little
that
fast.
one was very fast.
Little booger plants. Golly. This came up a couple times. The number that you provided, is that specifically Florida or is that a
Nope.
national number?
That is the National Poison Helpline.
Ah,
So as of 2000 and I want to say two, we have a single national number, and we get a little federal funding from HRSA, Health Resources and Services Administration, to maintain that national infrastructure. So wherever you are, you'll get routed to your nearest poison center by area code. So yeah,
yes.
Canada has a different number. I think it actually might be based on not you don't provinces. I think provinces may have separate numbers, but double check your local number.
All right. So yeah, all the safety officers out there, mash that number in your phone now. What was, man, I already forgot. What was it? Oh, it's right there. 800-222-1222. Put that in your phones.
Yeah. We've got lots of good information on the website too. If
Yeah.
not so much super detailed plant by plant, but there is some plant information there.
If I haven't gotten to somebody's question, if y'all would like to just raise your hand, we can do it that way too. I don't want to miss anybody. Anybody want to raise their hands? Okay, well, while you guys are thinking about raising your hands, I'm going to plop in the
Okay.
chat
I
a
see
link.
Wanda.
Oh, there we go. Oh, Wanda. Hi, Wanda. What you got?
Hi, good evening. Wendy, you mentioned not to wash the affected clothes with other clothing. Does it stick to other clothing while you wash?
So that guidance is actually a generalized guidance that we say for all, whenever you know you have any contaminated clothing or, for instance, occupational exposures, metal exposures, pesticide exposures, we always say wash that separately. Just on the off chance that there's residue or somebody pulls something back out of the wash before the cycle is done or whatever, we know it's an issue, say, for lead and pesticides, that there can be residue that can linger. With poison ivy specifically, we wouldn't necessarily expect it unless, you didn't use enough soap, for instance, or you only use Downy, right? So if you don't use a strong enough surfactant, then there's the potential for spread. But yeah, that's more of a general guidance. If you're ever washing anything that's particularly nasty, wash it by itself just to be extra safe.
Thank you.
Thanks, Wanda. Great. Chip.
Oh, you're on mute.
Unmute. Yeah.
Okay.
There
So
we go.
I volunteer a lot with the Boy Scouts as well, and we're in the woods up here in New England pretty much every week.
Yes.
And we're used to the vines and the poison ivy being everywhere, and we do the best we can, but we have a big bottle of Dawn dish detergent by the hose in the shop as soon as we get back.
Yeah.
And that seems to work pretty well for us. Do we really have until the end of the day to do that, or?
No, I
No?
think that 45-minute window is that was the recommendation from Dr. Weissman. Dr. Weissman is the former head of the Poison Control Network in New York State, so pretty familiar with poison ivy. So yeah, he said really you've got 45 minutes to be safe. But yeah, Dawn is great, right? It's an amazing surfactant, really good for getting rid of any type of oil. But in a pinch, regular hand soap would be a good first step.
Yeah, it's also
and remember,
pretty,
sanitizer does nothing. Hand sanitizer will not help you.
right. And then as far as cleaning up gear, if we know we've been out in it, we'll bring it home and stick in a bucket full of water with a big cap full of OxyClean, and then wash it again, like you said, by itself. My wife would be really unhappy if I threw it in with the regular laundry anyhow.
Fair.
And for all the Sawyers.
Thank you very much. This has been awesome.
Oh, great.
Glad you're here, Chip. So I know a lot of Sawyers are in the habit of bringing a little thing of Dawn dish soap in the field with them. So Sawyers, don't forget to decon the saws, right? Now we've learned we have a 45-minute window to do that. So we know we top off our fuel every time we take a break. We top off our fuel, sharpen our chain. And I would recommend probably wipe down with some Dawn dish soap. Marcus, you got a question?
Actually, I don't have a question. So for all the other admins from other states, like me in Texas, I mean, you can just contact your poison control, your local one. I already looked mine up, and they have somebody that can give training, as it seems. Just introduce yourself and say, we got this awesome presentation from Florida. Now you guys have to, provide us the same. And everybody will do it.
Yeah, they're
The
wonderful.
precedent has set.
Texas has 5 poison centers. They're an even bigger network than ours, but they're very active also on social media. You may need to give them a little lead time because this is a pretty specialized program that did require some research and sort of getting a little deeper because it's not a request we get all that often. But they are wonderful. The educators there will be able to help you. And if you'd like, I can put you in contact with the educators specifically for your community. Just let me know where you are.
I already I already emailed some Natalia Castina at the UTSA because I'm in San Antonio.
Okay,
And
perfect.
there's also a clinical educator. I'm not afraid to ask any of these. And if it takes a couple of months, we always have stuff going on.
That's great. Yeah, just a little lead time so that they can really, address your specific needs.
Thanks.
Right, well, I don't see any more hands up, but I did want to point out in the chat, what do we call this? Cortex Products. They've directed us to PK Safety, and they have offered a discount code on IVX and some of their outdoor products, which some of the wipe downs are really handy to have in your go bag. So maybe look at that, check it out, take advantage of them trying to help us out, or just, get Dawn dish soap. Seems a little bit cheaper. But, oh, we got a couple more here. Rob.
Hi, up here from Canada. We've got the hogweed, the really large, basically 8-10 foot
Nasty.
tall queen of leaf. So we get that on. We got it all over the place. So if you get it on you, what's probably your fastest, besides getting out of the sun, thing you probably put on to help layer it over, cover it up?
I don't want to give advice for your area because we don't have hogweed. So I would remember you don't have to wait for an emergency to talk to your poison center. We also answer questions all the time, and we actually love prevention. So that's an amazing question for your local poison center. Tell them what you do, and just say, is there something I should carry on hand? What are the typical treatments, et cetera? And they'll walk you through what you might need, especially if you're not, near a healthcare, provider. If you're going to have to, take some time before you see a clinician, what should you be carrying? I think my sister was exposed to hogweed as a child, and it was extremely memorable. It was terrifying. I mean, the blisters were massive, and I think she and her friends were whacking each other with it at daycare. It was just like really horrible.
That's brutal.
Yeah, sounds
Yeah,
like
but
me.
call with questions. If you're not, this was all very South Florida specific, and we're a very unusual area, zone 10, zone 9.5, in terms of what grows in our area. So your local poison center, though, will have the scoop on the plants that affect you.
Makes sense. You mind 2 final questions?
Go for it.
Okay, Courtney, what do you have?
Yes, sir. I'm sorry. I was like 3 minutes late. I totally had forgotten about the class, and it sent me a
good.
Google email. No, and I was about home, but then I thought my dogs are going to bark for 20 minutes, and my orange cat won't leave me alone. So I called the library, and they Jesus, they had a room, so that's why it took me a minute. But are there specific zones for? Is there poison control? One major one for every state? I realize Texas has a bunch. I lived in
Yeah.
Texas for a long time, in Austin and Travis County. I've lived in Florida as well. Went to high school in Tampa. I've also lived in New Mexico and Colorado. But I spent a lot of time in North Carolina around the Outer Banks, and just North Carolina is only like an hour and 20 minutes from me anyway. Is there one that's more for like, I don't know how to say this, like for a region, or is it?
Great question. Yeah, great question. So because we are a national system, right? We all work together. There are 53 poison centers, right, in the United States. And
Okay.
usually every state kind of figures out how they want to handle it, right? So for instance, Illinois has one poison center based in Chicago that does the whole state. But
Gotcha.
then the Rocky Mountain Poison Center does like 4 or 5 rural states, you know, that have fewer people, they
Right.
can be handled by one center. So Guam
Right.
is covered by Oregon, right? We all just figure out how to
Yeah.
divvy it up. And so you just pick up your phone and dial that number, and you will get routed to the poison center that serves that area code. We're trying to move toward a geographic information system based program, right? Because there are a lot of people that live in Florida part of the time, but then they're not in Florida the rest of the time.
Oh, there's not one yet
Uh-huh.
for that.
No, so
There's
there's
not a GIS system for poison controls yet.
no, not yet. We are
Wow,
working very
that's
hard on that right now.
That's very shocking.
Oh, that's
I'm
the reason I
surprised.
told them about, right?
I'm sorry, say
But
that again.
if you're in North Carolina, the North Carolina poison control system is lovely. And my colleague there is the educator, Alexis Steverson. So you're in good hands if you're in North Carolina.
Alexis
I mean, we
runs
know
it.
each
Okay.
other all personally. So
Alexis Stevenson got it.
Alexis Steverson, she's my friend.
Perfect.
Yeah.
And then last, Peg, what do you have for us?
I had a question, having just come from swimming around in fiberglass in an attic all day.
Oh,
When, yeah, I'm itchy. When I come home and wash, I wash with cold water first to keep my pores closed. And would that be a good thing to do when you're washing for poison ivy and other things, or does it really matter?
that's a good question. I can't really answer that. I would call the Poison Center and ask to see what their recommendation is, because remember, fiberglass, this is not really a chemical exposure that is going to lend itself toward soap, right? It's more of a mechanical irritation where it's working into the skin. And so they may have a completely different approach. So off the top of my head, I don't know. I have not heard that cold water was better than not. Just water and soap is what I've heard. For infectious disease, they do recommend warm water, you know, and soap. I know that that is more effective in getting off, you know, bacteria and viral stuff. But yeah, that's a great question. You stumped me.
Sorry about that. Thanks.
That's okay. That's the beauty of the hotline. I don't have to know everything. I'm also not a clinician, right? I'm an epidemiologist. So I work a lot with the data and the recommendations for treatment and management. But in terms of those types of clinical questions, I leave that to our doctors, nurses, and pharmacists.
Love it. All right. Well, that wraps up our time. Wendy, thank you so much again. We got a lot of compliments in the chat. So everybody's super happy you're able to do this for us. Sounds like some folks might be trying to set this up for their own regions, which that'd be great because I'd like
and
to
if
know a
you
little bit
want-
more about Louisiana.
Yeah, and let them know, you know, that you did see a program in Florida. You can use my name. If they want to see the presentation that I made, I will send them my slides so they can build it in a similar way, covering some of the same things with a local twist. So happy to help.
Perfect. So everybody that's on the call here, I'll send out a group email with the attachments on it and phone numbers and that way you can present it to your local folks and go from there. So thank you
Great.
so much, Wendy.
Justin, I'll also wait to send out the slides, and I'll add a little link that if people want to give feedback or additional questions or, you know, commentary or suggestions,
perfect.
I'd be happy I'd love to get them.
That's perfect. I love it. We'll absolutely do that. So yeah, I'll stand by to hear from you and then I'll push it out to the team.
Sorry, I just have one more question. Is anybody
Oh.
doing anything for Stop the Bleed month or anything, EMT week or anything like that? Do you know?
So that's something you can talk to one of your local leaders about. We offer
Okay.
Stop the Bleed locally. Usually any medical trained person, a firefighter, they can do it. And then it's just a matter
Yeah,
of
no, I just
asking
didn't know
around.
if we were doing any kind of booths or classes or anything in conjunction with, because it's also EMS week,
Right. No.
or anything like that, and it's Stop the Bleed month. And then I know Stop the Bleed Day is May 21st. So I didn't know if Team Rubicon I hadn't seen anything yet, or if anybody knew of anything coming up where they were gonna partner or do a community service event or engagement or anything for that.
No, as far as I know, that would just be a local thing. Absolutely worth asking. Right.
Okay.
So I think we are going to go ahead and wrap up. I don't want to take too much of Wendy's evening here.
Yep,
So
thanks,
thank
Wendy.
you
Y'all have a
very
blessed one.
much. Yeah, and everybody, thank you for being here. Thanks for being a perpetual student. And we'll see you in the field. And Wendy, I'm going to keep working on you to recruit you to come on our chainsaw classes.
You don't want me with a chainsaw. All right.
Well, you'd
Thank
be
you so much.
surprised.
Thanks, guys. Y'all
Thanks
have a good
everybody
one.
for your
Appreciate it.
service.
Have a wonderful night, everybody. Thanks for coming.
Bye.